Hey, it's Brad Perry with Kingwood Physical Therapy. I'm going to show you the hand hill rock today. We use the hand hill rock for many different things. We use it for the shoulders, we use it for the spine, and we use it for the hips. So I'll kind of go into each one and why we use it. Okay, so what we want to do is start like this in what we call a quadruped position, okay? This is called the hand hill rock, where we sit back and stretch. Okay, we can stretch it for the spine or the hips or the shoulders. Sometimes we'll do this, again, for like the spine, and so I'll teach people to do a little bit of a tilt, what we call a posterior pelvic tilt, or also angry cat is another name. So we'll get into that position here, and we can kind of sit back into it, and I can really feel the stretch here. So if we prescribe this for your back, and you sit back and you don't feel it, try to round your spine out a little bit by tucking those hips under and then sitting back to get more of a stretch here, okay? Now, for prescribing it for the hips, the spine, you kind of stay in what we call a neutral position and then sit back and sit all the way back. If you can't sit all the way back and it starts to pinch in your hips, you want to widen your stance up a little bit, okay? And then you can kind of even move your feet in or out to see what's more comfortable and try to get lower into that position, okay? So that's kind of a hand hill rock. Make sure for that one, you want to hold it about 5 or 10 seconds and do 10 of them at a time. Usually tell patients to do them, 2 or 3 times a day. The other reason we might give it is for the shoulders. So again, from here, we can kind of do like a little press up and get those shoulders moving a little bit, okay? And then from there, we're going to sit back onto our hands and really stretch out now our shoulders. And we kind of inch forward a little bit, and I really feel that in my shoulders. Just kind of sit into it for about 5 or 10 seconds and then come up, and you can kind of reset, flex, and sit back and really stretch out. You can also do a little lift here to really activate the shoulders a little bit more, but only do that if your therapist tells you to do so. But that's just some different variations of the hand heel rock and why we do them. All right?